A port wine stain or nevus flammeus is almost always a birthmark. It is caused by a vascular anomaly. Port wine stains ordinarily persist throughout life. The area of skin affected grows in proportion to general growth. Port wine stains occur most often on the face but can appear anywhere on the body, particularly on the neck and upper trunk. Early stains are usually flat and pink in appearance. As the child matures, the color may deepen to a dark red or purplish color. In adulthood, thickening of the lesion or the development of small lumps may occur. They are called port wine for their reddish color. Port wine stains may be part of a syndrome such as Sturge-Weber syndrome or Klippel-Tra copyright Norne-Weber syndrome. Types. Nevus flammeus may be divided as follows: nevus flammeus nucci, midline nevus flammeus. Genetics. Port wine stains were shown to be caused by a somatic activating C548 GAR, a mutation in the GNAQ gene. An association with RASA1 has also been described. Diagnosis. A healthcare provider can usually diagnose a port wine stain based entirely upon the history and appearance. In unusual cases, a skin biopsy may be needed to confirm the diagnosis. Depending on the location of the birthmark and other associated symptoms, a physician may choose to order a measurement of intraocular pressure or X-ray of the skull. A MRI scan of the brain may be performed on infants who have a port wine stain in the head area in order to check for signs of Sturge-Weber syndrome. If the port wine stain is inside the mouth, a provider may check the insides of a newborn baby's throat with a scope to see if there are any changes other than just the color. If the port wine stain is around the eye or on the eyelid, a referral may be made to an optometrist or ophthalmologist for a test of the ocular pressures in that eye. If swelling occurs in the port wine stain, it may cause vision problems, glaucoma, or blindness. Treatment. Many treatments have been tried for port wine stains including freezing, surgery, radiation, and tattooing. Port wine stains can also be covered with cosmetics. Lasers may be able to destroy the capillaries without significant damage to the overlying skin. Lasers and other light sources may therefore be able to reduce the redness of stains, although there is not enough evidence to recommend one form over another. For most people in trials of pulsed dye laser, more than 25% of the redness was reduced by laser after 1 to 3 treatments. Adverse effects were rare in these trials, although some people had changes to the color of the skin, especially Chinese people with darker skin. There can be pain, crusting, and blistering in the 2 weeks after treatment. The trials only followed people for 6 months, so long-term outcomes are not known. Up to 10 treatments may be necessary for improvement, but complete removal may not result. The use of topical rapamycin as an adjunct to pulsed dye laser may improve results. Treatment is generally given before 1 year of age. However, as it is recommended to be performed under anesthesia on small children, it is not always possible to get frequent treatments. For example, in Finland a child gets treated 2 to 3 times per year, resulting in a target of being ready before school age. After the laser treatment the skin is filled with black marks, the size of a pen. This is due to the laser instrument size. The black marks disappear within 1 to 3 weeks. The treated area can be sore and swollen for a couple of days. Prognosis. In the absence of successful treatment, hypertrophy of the stains may cause problems later in life, such as loss of function, bleeding, and increasing disfigurement. Lesions on or near the eyelid can be associated with glaucoma. If the port wine stain is on the face or other highly visible part of the body, its presence can also cause emotional and social problems for the affected person. It is suggested that gene therapy might be used as a cure in the future. Epidemiology. Studies have recorded an incidence of about 3.05 cases per 1,000 newborn babies. References. External links. Information about port wine stains from Children's Hospital, Seattle. Birthmarks.com, Sturge-Weber syndrome community.